Reconstructive Plastic Surgery and Burn Center at the Kolebu Teaching Hospital. They are my guests today, and we're going to be talking about the incidence of burns in the country, what it costs for people, apart from the aesthetics of it and everything, the health implications, financial implications, economic implications, and all that goes with burns and how they affect us. Good morning, ladies and gentlemen, and welcome to the Breakfast Show.
Thank you. Morning.
So I'll start with you, Safwa. How should I call you, sister or Safwa? Because I know that you are sister, right?
Yes, you can call me Eso.
Which one do you? Eso.
Eso.
Eso. Okay, so Eso, we'll start with you. What's the reporting incidents? On a day, for instance, how many incidents do you get reported?
Almost every day we get cases, and for a month we get at least 26 to 28 a month. So for just this 6 months, from January to June, we've gotten almost 160 cases so far. And out of the 160 cases, we've admitted 74 cases. And out of the 74 cases, 45 are children.
I will come to the logistics part of it. But what usually are the main causes of the burns?
Most of the time, they come with hot water.
Oh.
Hot water, especially with the children. Hot water is the leading cause. And then inhalational burns, and then hot oil, and then electricity, and then gas explosions.
So inhalation burns are usually associated with what, gas or what?
Most of the time with a smoke, anything that can cause smoke, and that can affect the lungs.
So I need you to explain that, because the others are quite simple. But for me, inhalation burns, I mean, how does it occur? And what type of smoke will cause that to happen?
From even car exhaust.
Oh.
Car exhaust. You can see some cars going, and the exhaust, the thick smoke that is coming from the car is very thick. And that one can also cause inhalational injury. And most of the time when people get burns or their houses catch fire and they are inside, the smoke that comes off it, they inhale it. And that is inhalational. Inhaling the smoke and burning the lungs. So most of the time, these people do not have burns on their skin, but their lungs are damaged.
Oh, so that's even more serious than the
yes,
ones
that is more dangerous. That is one of the most dangerous part of the burns.
But the most common ones are usually got to do with liquids and stuff like that.
Yes, please.
Okay. So let's say somebody gets hurt by being burnt at the moment. What should be the first thing to do?
The first thing is water. If it's not electricity. The first thing is water. Just ordinary water. Not cold water, just pipe water. Pipe water is okay for us. And you dose the person with the pipe water for 5 to 10 minutes. So between the 5 to 10 minutes, the person will be okay. Then you remove the clothing, but take care of the face.
By doing what?
Make sure the clothing are cut, but you don't remove
through the head, so that it doesn't affect the person's
face. Yeah.
Okay. Yeah. So this water application, can you also do that for if the burn is oil based?
Yes.
And even if it's inhalational?
For inhalational, because it affects the lungs, you can't see the burns. Mm-hmm. But the person will be coughing. The person will have swollen faces. The person will have soot in their nose.
Oh.
They spit and their sputum is black.
Plain English. Plain English. I have to spend a minute on the inhalation. Now we have to. I know what sputum is, yes. But in plain English, what are you saying?
Yes.
You mean saliva?
Saliva.
Okay.
Saliva.
Saliva is
yes.
is black.
It's black.
Okay. That's it. But let me come to you. So I've heard first degree, second degree, third degree burns. Can you explain to us what the various terminologies mean? So let's say somebody has a first degree burn. What does that mean?
Okay. So using the degrees refers to how you assess how deep the burn is. So people start saying first degree, but maybe if you look at the skin, that will give you a very easy way of remembering. So the skin has two layers. There's a superficial part, the topmost layer, the one we see that gives us color and all that, which is actually quite thin. And beneath that, if you had a cut before, you see a white. If it's a bit deeper, you see some whitish part. That's the dermis. That forms the majority of the skin. So with burns, if the burn is limited just to the topmost layer of the skin, that's the epidermis, then that becomes a first-degree burn.
Okay, so that's not too serious.
That's not too serious. So maybe a sunburn or a tan or something. And usually those ones should resolve in a few days, about 4 to 5 days, that should heal. Or we had a little smoke pass or steam pass over your hand, which didn't cause blistering. Then beyond the epidermis, if the burn goes deep enough to involve the deeper layer, which is called the dermis, then you can have, that becomes a second-degree burn. But with that, it could affect the topmost layer, the superficial layer of that deep, the dermis, that's the deep layer, or it could affect the deeper layer as well. But whatever will happen in a second degree burn, you will still have a bit of the dermis present.
No matter how burnt you are.
For a second degree burn.
Okay.
All right. Compared to a full thickness burn or a third degree burn where the full extent of the skin is burnt and usually would expose the underlying fat. Then beyond that, you can go to the fascia, the muscle, sometimes as deep as getting to the bone. In such cases where, let's say, someone who has a seizure disorder falls into fire and it's not rescued early enough, sustains quite a very deep burn. But to make it easy, we tend not to use degrees. In places where they use degrees a lot, you can go ahead. But you could say maybe epidermal burn. You could just stay with that. That becomes your first degree. Then your second degree becomes a partial thickness burn. So that you could have two classes. If it involves the superficial part of the deep layer, the dermis, then that becomes a superficial partial thickness. If it involves the deeper layer of the dermis, then that becomes a deep partial thickness, or also called a deep dermal burn. Then you can have the third degree, also called a full thickness burn, and then anything beyond that.
So at what point, you mentioned that if you have just the epidermal burn, it takes about 4 to 5 days. And I think that's what we all sort of, find ourselves having. Maybe you're cooking and a little steam passes on the back of your wrist and then you get stuff like that. That takes 5 days or 4 days or even sometimes even less. So we get that. But for the other type of burns that seem or sound a lot more serious, what's the healing time?
Okay, so if you notice blistering, that's usually for burns that involved the deeper layer of the skin, the dermis. So that's a partial thickness burn. If it's the superficial partial thickness or superficial second degree, that is likely to heal in about 2 weeks. If you extend it maybe 3 weeks, it should heal. Then if it involves a deeper layer of the dermis, then that should heal within 3 weeks, maximum 4 weeks, that should heal. If it involves the whole extent of the skin, that isn't expected to heal unless it's a very small area where you have adjacent skin, growing in to cover the wound. But that is not expected to heal for a full thickness, anything beyond that. So that's usually the timelines.
Sometimes you see people with burn scars will come to scars, but that look like the skin has been fried. Is it because of what kind of burn is that? Just by looking at it, I'm sure everybody's had a burn or two, in their lives, but I'm talking about the one that sort of shrinks the skin and just fries it up.
Okay, just like you could put an animal or something on fire.
It's not funny, but
So that usually will be a third degree burn or a full thickness burn, where the skin may look leathery.
Yes.
Or it could look charred, like you've really burnt it. It becomes thick because you've burnt all the skin. Your normal supple skin that is elastic, loses all of those properties. So it becomes tight, like a tight band. And sometimes if such a burn is circumferential around the limb or around the chest or the neck area, that could constrict the flow of blood to and from those areas. So
it has a lot more health implications.
Oh, sure. If it's a full thickness burn and it's quite, immediately it could lead to something that requires early surgical intervention. For example, it could lead to something called a compartment syndrome. So,
which
means that, let's say, in that area, let's say it occurs around the limb. So it forms a tight band. You know, there's skin here. Beyond that, there's fat, there's muscles. But these muscles are surrounding the bone. And the muscles have been encased in a tight layer that is unyielding. It's called a fascia. So if you have these tight bands there, it's like you applying a tourniquet around somebody's arm. So the venous outflow be impeded, or well, to start from capillaries first, then the venous outflow be impeded. Then if the pressure keeps mounting strong within, or there's a lot of swelling, and then a lot of buildup of pressure within that compartment, then it can even stop your arterial blood from getting in there.
Oh dear.
And that could lead to even death of the tissues in the extreme cases.
Wow.
So in such situations, if you notice that, it becomes a surgical emergency. Although you need to resuscitate first as a priority, then you need to go to theater at the same time and relieve those compartments.
I was just thinking burns. I mean, it's a mundane topic, but I didn't think about it like this. So, it's, I'm almost short of words. But so before I come back to Dasipo, let me ask you. So let's say I think. I'll stick to the first and second degrees because the third ones is a bit. So let's say I come to the hospital with a second degree burn. What type of treatment should I expect?
For my outfit, when you come there with a second degree burn, initially we have to check your vital signs, then ask you the history and all those things. Then after that, we write items, which after the items, then we estimate the burn. So we actually clean the place with your saline and then apply some silver sulfadazine on it and then bandage. That's the second degree. Most of the time with the first degree.
So you don't necessarily even have to see a full-blown doctor for a second degree burn?
Most of the time the doctors come to do assessment.
Okay.
They do assessment. So they come and they check. But most of the time with the first degree, that's the superficial burns. Most of the time you don't have to.
Okay. So let's say I get burns. Let's stick to the middle of the road again. Second degree, and then I come and then you've seen me and I've gone back home. Should I watch what I eat? Will it have an effect on my healing time?
Yes, please. We have various type of food that helps in healing. And most of the time we don't just leave you. We allow you to see a dietitian and a psychologist as well. So the dietitian helps you in planning your food for you. So the type of food that you are supposed to eat and add up. So you may have some vitamin C, you may have some oranges, you may eat some eggs to boost your immunity. Because with burns, as the wound is there, you are losing a lot of fluids. You are losing a lot of proteins.
Oh.
So because you are losing a lot of proteins, you have to replenish it. So eggs, beans, you are supposed to eat. You are supposed to eat some fruits to help in the healing of the wound. So vitamin C or the fruit itself, that's the orange.
Okay, so let's say I've been seen to, I'm well and I've gone home. Should I take care of the wound myself? Is it advisable? At what stage can I start taking care of the wound?
No, please. We allow you to be coming every 3 to 7 days to come and see us in the hospital. So everything is gone totally.
So if you're like me and you are fidgety and you keep touching it and it moves before the day, can you come in?
Yes, you can. You can. We are always there to help you. But we tell you when you like touching the wounds and other things, you cause another infection. Your wound will not heal. Your wound will not heal. Because people like putting all sorts of things on their wound.
I'm guilty.
Yes. You come and there's cow dung on the wound.
Oh, no.
You come and there's GV paint on the wound. You come and all sorts of things. Egg, shells, and other things. Tomatoes. At times you only need fish to prepare stew on somebody's wound. A lot of things on the wound.
S-O-S-O. That's it. I was okay.
Yes,
you go on the night coming.
Second degree burn or partial thickness burn. It's not what we've described so far. It will just refer to some very minimal burn that wouldn't need admission. You can have second degree burn, like I said. It could be superficial second degree, or deep second degree. but also the extent of the burn. And if you have other comorbid conditions, would require that we need to admit you. The age of the patient will require that we need to admit you, because a lot of times, if it's extensive beyond a certain extent, we'll need to replace fluids. We need to give adequate pain relief, give you nutritional supplementation, and so many things. So hospital admission can become a very important part. It is a very important part of burn management, even with second degree.
I'm told we have very little time, and I told you this could be either too short or too long. It turns out it's a little too short. But let me ask you how expensive it is to have like proper burn treatment. I'm not talking about just, talking about making sure, because you know how somebody gets burnt and they get a scar and it affects their confidence, so they'll need to take care of it.
All right. So this is the National Burn Center. So once it's a burn center, there are certain types of burns that we admit, which means that they must be extensive for the age and then other medical conditions of the patient. And burns is quite a severe form of injury in terms of how the body responds. I mean, to every form of injury, the body responds, but this is usually way out of line with the injury. And it's quite severe and extensive. It goes on for so long a time. Sometimes some of the changes that the burn patient will have can go on as far as 20 years.
Oh.
So this is not a just a shimmy, so that's okay, something. No, it's not a light thing like that. So this patient needs to be well taken care of. And it affects every system of the body. So managing a burn patient is one of the most expensive things to do, to take care of in any part of the world. They may require several surgeries. Initially you need to resuscitate them, get them to a state where they are stable. And these are people that are prone to infections. And when they do have infections, you may have to use very strong antibiotics. Sometimes you have to go to the extreme of use the strongest antibiotics there is.
Do you have, it's a silly question, but is there like incidence of amputation as a result of burns high?
Oh, not high, but they could have amputations. There was a picture of a child that was shown me. The story the mother was giving really didn't match up to what we saw. The child came with a hand all the way up to just above the elbow. Full thickness burns, and the fingers were looking dark, and we had to amputate. Somebody had electrical burn, a student who had gone and rotation, rotation or something with the ECG, and then they touched a cable, live wire. I don't know how the electricity was put through, but he sustained that. Then developed these compartment syndrome that I mentioned. Was offered fasciotomy, but it was too late. By the time they reported to the facility that could carry out the surgery. But he came, the limbs were all gangrenous, had to amputate, double amputation.
Oh dear.
But there's been a time where 4 the limbs have all been amputated. Both upper limbs, lower limbs were all gone. So it's not a common thing, but it's something you should look out for and make sure if you can mitigate against that, that's best.
Do we have a lot of surgeries, plastic surgery with regards to burns? I remember that a few years ago, a friend of mine's son, got burnt on the leg. It was a really bad burn. We're talking about grafting and all those things. Not much was done, but he sort of healed. Thankfully, he was a boy. But do we have a lot of surgeries in that regard?
Yes, we do. We do have a lot of surgeries that can be done for burn patients to resurface or reconstruct their defects. So it could be in the acute setting, where they may need acute surgeries like the release compartment syndrome, sometimes even amputation at the time, or some other surgery. Then, once you've gotten them out of this phase where they've been resuscitated and all that, they are now good to go, infections have been taken care of and all these things, you can go in and sometimes have to debride the wound, because the wounds get infected, like a full thickness burn, it's called an eschar, full thickness burn skin. That it still stays there, but it doesn't, dislodge that easily. Well, there are 2 schools of thought. You could be conservative, allow it to dislodge, or you could go in and just do excision.
What's the implication of it dislodging?
What's the
implication if it dislodges?
Oh, that means you are going to wait for a long time. Because, but then the other thing is that there aren't blood vessels going towards it, so it forms a very good nidus for infection to form underneath.
Oh.
And these can have deep invasive infections that can overwhelm the system.
Before I come back to you, I see that Safwa has some photos that she'd like to show us. They are a bit difficult to watch, and so viewer discretion is advised for the photos that we are going to show. If we will show them, it's not on yet, and so I don't know if the producer will pick it up. But yeah, these are so Safwa has photos of burns and the various degrees of burns. I think it's a bit early in the morning. I'm not too sure. Oh, Leo, my stomach is churning a little, but
most of those she's showing are largely they are partial or second-degree burns. Those pink areas are usually more pink areas are the superficial second degree. Then where you have a mottled appearance, variegated appearance, like on the lower left corner, that's more of a deep second degree, also called a deep dermal.
You know, sometimes when you see the burns with the lower right, you have the pigmentations, and sometimes your skin never gets back to its natural state. Is there something that can be done about it?
Yes. So first, from the burn injury, I mean, you are assaulting the skin, and the cells that produce your skin color, the melanocytes, could suffer various extents of damage. They could recover or they could not. I mean, so we give you time, maybe up to a year, sometimes up to 2 years, for these cells to recover. If they recover, then they can't produce the pigments again, but we can't guarantee that, I mean, they are going to be as they were before. Then, so that's the other part that's the one part where the coloration becomes lighter, so you are hypopigmented. In another instance, when they heal, those who have bad scars are usually those who have deep second-degree burns to full-thickness burns. So those deep burns, they are the ones, or burns that does not heal within 21 days. Within 3 weeks, the burn doesn't heal. Usually, we must intervene.
Okay, I'm told my time is up. So, Mensah, do you have anything to say? And when you come to talk about your final words, you might want to add how these things affect a person's psychology and whether they need to see a specialist to talk to them about how they look and the aesthetics of it and everything.
Yes. For me, I'd say we should take care of our children very, very well. Children are very inquisitive. They like to fidget with a lot of things, with our gadgets. So we should be able to take care of how we put our phone in the charger to charge and leave it on. Because children who are crawling can easily pick it up and also charge their mouth and cause electrical burns to their mouth. We should take care of how our kitchen is. The place should be airy, not crowded. We shouldn't be having a lot of curtains and other clothing in our kitchen. Our kitchen should just be plain. Okay. Our gas cylinder should be far from the source. So please, let's take care of these things. And let's make sure when we have children in the house, any form of burns that occurs, please remember water first, except electricity. With electricity, look for the source and put the source off. Take care of yourself first before you also take care of the person who is there.
Thank you very much, Eso, my friend. And Doc.
Yes. Burns affects the psychology of the patients tremendously. And it's a whole team that takes care of them. The burn surgeon or physician and surgeon, sometimes the intensivist, because he may have to be admitted to the intensive care unit. Then we have the physiotherapist, we have the clinical psychologist, because it affects their psyche a lot. We do have psychologists, at least at our center, at least 2 of them, with their interns and other students who are on rotations. And once we admit, they come in, they start seeing, because it affects them right from the time of the incident through to the time, if they do survive it, thanks be to God. But right after, they have to deal with a lot of scarring, pigmentation, so many issues that they will need serious counseling from the time they are seen till they are discharged, and even much more thereafter, because they have to be integrated into society. And these ones, people stigmatize them and all those things.
Dr. Dasibre Ahinsai and Safwa Ompong, thank you very much for the insightful conversation. Hi, Kakra. I remember that my son went and got burnt. We went to a party, and then he went and stood by a motor that was, and we had to it was a whole situation. So I think mothers also need to be a little more careful when they are with children and it's a source of heat. But thank you guys for talking to me. It was very insightful, and I didn't think that talking about burns, which apparently is the 5th cause of injury-related deaths from children, especially, will be so interesting. Thank you guys. Thank you. And thank you for watching.